Okay, so thank you very much for that very warm introduction. So my name is Joaquin T. Sapul Jr., and of course, I will be your speaker for this afternoon. I am actually tasked to deliver this topic for 30 to 45 minutes. And sabi ko, challenge ata ito ba? Because parang kukulangin ako ng 30 to 45 minutes. But nevertheless, don't worry mga colleagues because I will do my best to to deliver this topic within the specified time frame. Ayon. So thank you so much Southwestern University FINMA for giving me this opportunity to connect with my colleagues there in Cebu. You know what? I once worked in Cebu in 2014 and I really miss Cebu. So I really look forward to be there most probably in maybe soon, kung hindi man ngayon. But I am really looking forward to go back to Cebu for a vacation, of course. So ayan. So without further ado, we shall be discussing on the resiliency of the nursing profession with or without pandemic. And yung topic na to ay binigay sa akin by, of course, a colleague that is close to my heart, si Ma'am Jofel Borja. So thank you so much for this avenue because aside sa pag-share ng knowledge ko, I would also be reconnecting with the people who became part of my life when I was in Cebu City. So yun, so let's try to move this thing forward and let's continue to journey ourselves this afternoon towards acquiring new knowledge perhaps, or most probably kung hindi man knowledge, at least something to ponder or for you to introspect, to impact your perspective as we talk about the nursing profession even with or without pandemic. Okay, so let's now proceed. So disclosure muna ako, I am presently affiliated with West Visayas State University Medical Center here in Iloilo City, and at the same time a part-time faculty of the Graduate School of the College of Nursing of West Visayas State University. There are no related conflicts of interest related to this speaking engagement. And with that, we're all good to go. Kaya let's proceed now with our discussion for this afternoon. But before that, rather, let me present to you our expected learning outcomes. Our objectives for this afternoon would that you, nurse participants, would have discussed resiliency in the context of the recent changes in the healthcare system. Alam natin na maraming changes na nangyayari. Also have discussed the issues and challenges confronting nursing and healthcare with or without pandemic. I think kailangan nating tutukan din ito because we can never move forward without understanding our present state. And of course, lastly would be have explored strategies that build or maintain resiliency. So we're going to explore on these three things as we move forward. And kakayanin natin to in 30 to 45 minutes. Now, if you are going to go through several search engines or dictionaries or you Google it and you will type the word resilience or resiliency, the very popular definition na ibibigay sa inyo is something that talks about bouncing back. That's why what you can see here on my slide are three balls, of course. No, nagba-bounce sila. And if we are going to take note of the definition of resiliency, as I mentioned to you a while ago, one's adaptability to bounce back to a normal state or to the usual state even before the occurrence of a specific trigger, stressor, uncomfortable situation or scenario, then if you would be able to bounce back, either gracefully or successfully, then you have that certain degree of resiliency deep inside you. And I really do hope that majority of us, if not all, especially working in healthcare, would have this certain degree of resiliency na talagang present sa bawat isa sa atin because our task or our profession as healthcare providers ay hindi madali. And we are being challenged on a day-to-day basis to deliver at our best, safest, without compromising quality and safety. So now let's try to move a little bit further by asking you this question as part of a self-assessment on resiliency. And on a scale of 1 to 10, with 10 as the highest and 1 is the lowest, how would you rate your level of resilience? Now, perhaps some of you would say 10, others would say 5, or baka yung iba nga siguro mas mababa pa sa 5, no? Or in between 5 and 10. So I really do hope na alam nyo kung paano nyo i-rate, at least man lang to project or to estimate kung saan ba kayo banda as regards to your resiliency level. And aside from answering the first question, I am also challenging you to answer this second question, a deeper query on resiliency, of course. And here it goes. With or without pandemic, does your concept of resiliency remain the same? Maybe some of you are asking, bakit kaya tinatanong ni Mr. Sapol yung question na to? I am raising this question because human as we are, we change in time. But that doesn't mean that everyone will really have to undergo a change. Some of you might be able to already manifest resiliency even before the pandemic. And right at this point, while we are trying to transition or to wean ourselves with this global health contagion, yung level of resiliency ninyo ay hindi natitinag. Hindi siya bumaba, but instead, it's either nag-maintain lang siya or nag-increase pa siya. So that's something that you really have to be mindful when you are taking a closer look on your resiliency. And let's try to move further. Because yung pinag-uusapan natin ngayon is of course the healthcare system. And when we talk about the healthcare system, it is always complex. Complex because it is directed not only to one single group of population. Lahat ay sakop ng healthcare system natin. And our healthcare system is being challenged also by the diversity, disparities, complexities, and so on and so forth. Kaya napakahirap din para sa isang healthcare system nang mag-survive through the test of time because its direction, its commitment, nor its priorities are not only directed to a specific group of population, but actually lahat ay kailangan niyang i-encompass. And alam natin, for the past 3 years that we have been journeying on with the COVID contagion, marami tayong pinagdaanan. We have explored and experienced issues and concerns as regards to logistics, resources, infrastructural issues and concern, manpower, and so on and so forth. Sobrang dami. And here we are right now. After 3 years, we are still standing. Some of our colleagues have actually fallen. But hey, we are still here. Andito pa rin tayo. And we are serving our clients with a commitment to care and to value them as a unique individual. But while trying to understand what I just mentioned or said to you, dear nurses, napakahirap, di ba? Sometimes it's like easier said than done. Naggrabe yung promise na ibinibigay sa atin as healthcare professionals that are actually upon our shoulders. But that's what and who we really are as healthcare providers, as nurses. We are here for a specific reason, and that is to prioritize the patients and the clients that we serve. But the question there is, how about us? Paano naman tayo? And that's the reason why we are exploring this topic for this afternoon about resiliency. When we talk about nurses' welfare, napaka-broad nun. But if we try to explore on the concepts and at the same time, the nature of resiliency in relation to a unique individual, it would be easier for one nurse to really understand kung nasa anong phase or state siya ng resiliency. There are quite a number of evidence-based and approved tools na pwede ninyong i-utilize if you would go into the search engines or internet. Marami kayong makikita. But what matters there is, sana makapag-undergo kayo ng assessment or evaluation para mas maintindihan ninyo kung sa anong state or level kayo ng resiliency post-pandemic. Now, we are in the era that we have already traveled or surpassed yung panahon na kung saan ay merong pandemic. Be it in nursing education, yung mga schools natin nag-transition. They have adopted diversities and at the same time diverse methodologies and approaches just to facilitate and continue the quest for educating the future nurses, the Filipino nurses, or the nurses for the world or of the world. And even in clinical setting, in hospitals, there are quite a number of reforms and changes that have been taken place just because of this pandemic. And even in researches, nagkaroon ng avenue na kung saan mas lalong pinag-aralan or pinagbigyan ng pansin yung concept or context on emerging and re-emerging diseases, as well as their impact to the society, the community, and so on and so forth. Kaya yung 3 years na yon, mga nurses, those 3 years that we have actually surpassed ay dapat wag nating kalimutan. And it is about time for us to really reward ourselves. If none yet has attempted to give you a pat on your shoulder, then who would you expect to do that for? You can also do that to yourself. You give yourself a pat on your shoulder and tell yourself that you have done such a great thing by being a nurse who will serve the patients and our constituents, Filipino brothers and sisters. Kaya yun lang, we started with the complexity of the healthcare system. Kasama na dun yung diversity in the human behavior. Then, kasama pa dun yung mga specific events and scenario na nag-aggravate ng state of balance natin. And that global contagion, COVID-19, is something in our generation na hindi natin makakalimutan. So now, why then resiliency or resilience matters? Simply because resiliency both has the enduring and the emerging factors. When we talk about the enduring factors, come to think of it about success. It is not easy to obtain or achieve success. You have to work hard for it. You have to struggle for it. You really have to put things in order, or even sometimes you do experimentations, because the direction towards success is really directed towards going up and not always going down. So you really have to exert effort. And by the fact, or by the mere fact that you are exerting additional effort, it means that you have to endure something. Same thing with resiliency. Resiliency is best or better understood if you know the enduring factors. Now, let's proceed with the emerging. Resiliency matters because of something that might emerge again and again from this day onwards. Yes, we have succeeded the main phase of COVID-19, but that does not mean that COVID-19 is the end for everything. There will always be another challenge that awaits us. And if we do not exactly know nor understand our resilience level or our state of resiliency, then what would probably happen to us if another wave of challenge, trials, or contagion would come along our way and disrupt again our state of balance or normalcy? That is why we are trying our best to really discuss and at the same time better understand kung ano nga ba yung ibig sabihin ng resilience or resiliency na ito. Hindi ibig sabihin na tapos na yung COVID-19, hindi na kailangan or hindi na importante yung resiliency. My beloved nurses, our journey here on earth is never static nor stable. Same thing with being a healthcare provider. As a workforce of our nursing profession, we are designed to face the day-to-day challenge, and one of those challenges would be disruptions in our levels of comfort on the things that we presumed as normal. And just like the global health contagion, marami pang nag-aantay na pwedeng mangyari na kung saan we nurses and other healthcare workers would be in the forefront to safeguard and to roll up our sleeves to work with other agencies and entities to protect and preserve the people of this nation and the world. Now, what I'm showing to you is twofold. I mean, the twofold aspects of resiliency. It could either be personal resiliency or organizational resiliency. Pag sinabing personal, it's like more of the understanding of yourself, no? Yung kino-consider mo ay yung sarili mo. That's why what you can see here in the slide is resiliency. Then you have their outlook on work, because we're trying to relate this to work. Either you work in the hospital, you work in the public health unit, you work in other health-related facilities, or you work in the academy. These three things are actually applicable. Your outlook on work, how do you see your work? Your self-efficacy, were you able to achieve the desired outcomes? And your coping strategies. And given all those challenges and difficulties, how is your body, and at the same time, how is your psyche trying to support you to achieve a specific outcome? And that's resiliency. If you are a person who sees to it that there is high resilience, you see work as something that you really value, you're passionate and you enjoy your work, you learn from your experiences, and you can really say that you are doing such a great thing and something about it, and you are utilizing active coping. But if you are on the other side, just like a person who really believes na, oh, medyo mababa yung resiliency ko. So most probably, your manifestations would that be, you see work as work and finished at the end of the day. Yung tama lang yung makapasok ka, tama lang yung makauwi ka. You let nature run its course. Hinahayaan mo na lang. You do not take things to heart. You take it one day at a time. You forget and go home, and there is passive coping. So I hope na yung slide na to, I know moms and sir, 30 to 45 minutes will really not be enough for us to really go through with this resilience. But I hope na kahit gaano ko man tinatry na medyo bilisan yung discussion natin, you see the value on every word that I say and on every topic na dinadaanan natin. Kasi even man lang kahit on the tip of the iceberg, ay kaya nating matouch as we try to navigate and prepare ourselves towards that resiliency state. And if we talk about organizational resilience naman, tandaan ninyo, as healthcare workers, aside from understanding our own level of resiliency, we have to understand that we are considered human capital or human resource of an organization or an institution, or shall I say, a hospital, a university, a school, a clinic, a rural health unit, and so on and so forth. So napaka-importante na dapat in the first place, alam mo kung ano yung state of resiliency mo, because as a healthcare worker, katulad na kung ano tayo ngayon, as frontliners, as professionals who would be placed really in front to face whatever contagion, health contagion that might come along the way, we have to serve not only ourselves, but also the organization where we are a part of. So it is also important for us to understand organizational resilience. Aside from the fact, of course, na mas gusto nating maintindihan din kung anong ibig sabihin ng personal resilience. And when we talk about resilience in healthcare, yung yung slide na pinapakita ko sa inyo is something that was taken in the internet, and this was a study that was conducted in 2022. And it really says there that the results show that across levels and contexts, healthcare professionals collaborate to respond and adapt to change, maintain processes and functions, and improve quality and safety. So meaning, if you will really be so bookish as regards to organizational resilience, napakadaming pillars or components yung organizational resilience. Parang performance indicators yan na would really tell you that indeed an organization is resilient. But based on our presentation as of this time, I am highlighting here the role of teamwork, collegiality, camaraderie, collaborations, interactions, and interdependence as a critical role or a critical process or approach if we want to achieve resilience in healthcare. Kaya napaka-importante. Like us, we are representing the nursing profession. Or kung sa hospital ka man, nursing division. If you want to support your organization or the hospital where you are a part of, hindi pwede na yung pagtutuunan mo lang ng pansin ay ang nursing service division. Of course, your primary intention is really to safeguard and drive the nursing service towards a better state or a higher state of resilience. But that is something that can be tagged as a siloed approach if you only think of nursing. That is why you also have to move forward while considering also the movement of other divisions around you. You move forward and you invite them also to move with you and to hit the direction of getting things done by moving forward, by bouncing back, and by recovering from whatever challenges na kinaharap ninyo or hinaharap ninyo, just like the COVID-19. Now, this slide is also about organizational resilience, and I got this from Bartusevician, grabing hirap na pangalan, in 2021. And yung study results nila show that to ensure academic, ito naman academic perspective naman to, continuity and build resilience, the university has to develop anticipation, coping, and adaptation capabilities and act on lessons learned. The research findings also revealed the capability of a university in coping with the unexpected challenges and potential to become a resilient university. So you can see here na meron kang tinatawag na organizational resilience encircled in red. And inside this, ay doon mo makikita yung anticipation, coping, adaptation. It's just a process. It's just a process. You started with that prior knowledge, then you go into anticipation wherein you observe and you identify, along with preparation, of course. And after that, you go with the coping. You accept that there is actually a problem, a specific scenario, let's say COVID, meron talaga. Then you start to develop and implement solutions. No? You start to develop and implement solutions. You do not allow yourself na mapako or be nailed by the situation itself, but instead, you have decided to work things out and try to address the specific crisis. And then you go into adaptation. You go into reflecting and learning, and most probably, you also reach the phase wherein you go about changes, change management. And then nagkakaroon ng cognitive action and behavioral action na tinatawag. And these things are also being affected by the several factors. Resource availability, na alam natin nangyari sa atin yan, social resources, partners, and at the same time, power and responsibility, which reflects leadership. And same thing, mapa-university man or healthcare setting or clinical setting, it's like the same. Magkapareho lang yung principle na binibigay niya, that organizational resilience for both universities and hospitals ay isa lang yung intensyon na yan. To prepare, to respond, to adapt, and to recover. That is organizational resilience. Now, when we talk about healthcare or hospital, may tinatawag tayong mga priorities and commitment. And these include positive patient care outcomes, the provision of holistic medical and nursing care, and leadership excellence, direction and support. Napaka-importante when we talk about resiliency, leadership support. Then quality management, that gives us the high reliability and working system, high impact services that focuses on client-centered programs and innovations, and last but not the least, human capital supremacy, workforce welfare, and excellence. You know what? I really love this slide, my dear colleagues in nursing profession. Take time to take a look on these priorities and commitment of healthcare, of hospitals, positive patient care outcomes, leadership excellence, quality management, high impact services, human capital supremacy. And you know what? If you would be able to meet all these things na prioritize or kinumit natin, just imagine how beneficial it would be to our levels of resiliency. Napaka-beautiful ng mensahe ng slide na to. Our commitment is to serve our patients through positive outcomes. Our priorities and commitment to ensure that there is leadership that exists in your organization. How can resiliency be supported if walang leadership? Quality management, which brings us further and closer through processes, systems, and standards. High impact services, giving our patients what they truly need, and at the same time, protecting them from financial risk. And last, human capital supremacy. Tayo yun, mga nurses. Isa tayo doon. We are one of the human resources of the healthcare industry or any avenues of nursing na napaka-critical yung representation sa society. And we need that our welfare shall be protected or safeguarded. More so, our competence and excellence would be leveraged and scaled up. And then we can really say that resiliency is key to achieve all these things. No? Napaka-importante talaga. Yung mga priorities na to ay kailangan para din ma-achieve yung tinatawag nating resiliency. Now, for the nursing profession, building resilience in nurses and other healthcare workers can serve as a protective factor against negative outcomes related to the job, including burnout, anxiety, and depression, and can improve patient outcomes. One strategy for promoting individual nurse resilience is promoting expression of gratitude. Defined as the quality of being thankful, gratitude can be practiced in several ways. One of the simplest ways to foster gratitude is through meditation and breath control. Deep breathing and consistent focus allow the mind to settle down and gather itself. So, kailangan natin gawin yung mga bagay na yon, no? And I really appreciate the role of gratitude. Imagine through expression of gratitude, it paves the way towards the achievement of resiliency. Kaya tayong mga nurses, dapat marunong tayong magpasalamat. We need to appreciate and be grateful for the blessings na meron tayo on a day-to-day basis. The fact that we were able to report to work, to care for our patients, to let our patients receive the care that they need It's something that we really have to appreciate and really uphold, because expression of gratitude, as per the American Association of Colleges of Nursing, is a strategy in achieving individual nurse resilience. Now, how about in nursing education, administration, and nursing research? In nursing education, we have here adaptability and flexibility of educational delivery, methods, provision of highly competent educators, educational reforms and innovations, change management. And for nursing administration, resiliency can be manifested or evidenced by having strengths based leadership, strategic management, risk based thinking, change management, availability of resiliency management framework. And for nursing research, we have explored on partnerships and interagency collaborations, and that can still be considered a factor or a describer for what resiliency in nursing research is all about. Then also exploring best practices on change and resiliency management. And I think we have explored on quite a number of things already, ladies and gentlemen. I know that this topic is really something that is quite deep to really fathom. But I think the bottom line of this webinar na ginagawa natin ngayon is for you to understand that you as nurses are human beings. We are human beings. Nakakaramdam tayo ng challenges, and we know that there are pressures surrounding us. There are expectations required of us as healthcare professionals. I really do hope that in the process of building your resiliency, you are trying to be kind to yourselves. Na you always ensure that you really walk through the process of understanding what is really happening deep inside you. Pag may mga challenges man kayo na pinagdaanan na hindi pa na-address, I really hope so that you are not alone in working things out and addressing those circumstances na nakaka-affect ng resiliency mo. There is still a long way to go. And we nurses ay napaka-importante sa mga other agencies of both government and non-government organizations, or even with our partner private institutions, in ensuring that we work all together in the achievement of the best quality of life that we could offer to the patients and the clients that we serve. And it is very important at the same time that we need to work on with our own resiliency. I mentioned kanina yung personal resiliency. And now I also mentioned about organizational resiliency. And we need to work our things on a day-to-day basis, ensuring that we also address the things that have to be corrected or fixed inside us. Because mind you, nurses, it would really be hard to push yourselves to take a step on a day-to-day basis, to take a step forward on a day-to-day basis, if we in the first place also requires fixing. Kaya dapat tingnan natin kung ano yung mga bagay na dapat i-correct natin, i-improve natin, or i-address natin as regards to our resiliency. Only then, we could work with other members of the healthcare industry in ensuring that we address the needs of the society, the needs of our patient, and our own needs as members of the healthcare and nursing profession. So I think that concludes my webinar for this afternoon. And here are my references. And with that, with our theme, resiliency of the nursing profession with or without pandemic, this is Joaquin Sapol Jr. saying, daghang salamat. Thank you very much. I am now ready to entertain your questions.